Didi wanted her daughter to be sick. Gypsy wanted her mom to be murdered. Such an interesting title for an article, although longer than the average titles, and it seems to give away more information than it should. It still manages to draw the reader to explore the bizarre case that the writer is about to explore. This story is about a 48-year-old divorced woman who feigned disability and a plethora of illnesses for her daughter Gypsy. This woman by the name Didi claimed that her daughter had cancer, leukemia, asthma, and even muscular dystrophy. She made her daughter receive treatments for these diseases, even if the intervention meant having a surgery. To the neighbors, Gypsy was the poor, sick kid who was stuck on a wheelchair, fed through tubes, and went around with oxygen tanks to help her breathing. Turns out, Gypsy was never sick, and she did not require any form of medical intervention that her mother made her go through. It was a fraud. But at 19 years old, Gypsy realized the type of abuse her mother was subjecting her to. She plans, in pursuit for freedom, she plans the murder of her mother, which is executed by her online boyfriend. The writer does a fair job at representing the truth about this case and directly alludes to the 1-year research she did on it. She includes direct speech quotes from people she interviewed who were involved in the case, such as Kim, who was Didi's friend, Rod, Gypsy's father, and even integrated some of Gypsy's grammatically wrong sentences, such as "whenever I was 19." All this increases the credibility of the work. However, the use of certain quantifiers to describe the subject biases the imagination of the reader, and in a subtle way starts to create a distinction of who is the victim and who is the culprit. She described Didi as large and Gypsy as a tiny thing, as if she's trying to create a physical contrast between the two people and tries to show that Gypsy was vulnerable and Didi, out of her largeness, had some sort of power and control over Gypsy. Of course, with this kind of size contrast, we do not expect Gypsy to have a fighting chance against her supposedly large abuser. Further, the writer uses extreme words to describe Gypsy's conditions as if trying to draw the reader to sympathize with her. For example, she says Gypsy was confined to a wheelchair and overwhelmed by a pair of glasses, and her teeth were crumbling and painful. This form of sympathy develops the reader devotions to Gypsy, and it becomes very easy for them to question the fairness of the 10-year jail sentence Gypsy received for second-degree murder. After all, she was the victim subjected to abuse for over 20 years. Was the act of planning her mother's death not a... On the other hand, the writer depicts Didi as a culprit in this case. She quickly calls her out on her lies about Gypsy's health and her allegedly abusive family. However, when the writer talks about the positive things Didi did, she does so with hesitation and might suggest that she is skeptical about her. She says people remember her as generous with her time, when she could be, generous with money. This sort of structure in this sentence shows that the writer does not believe that Didi was ever generous with money, or when she was, she did not do it out of pure intentions. Additionally, the writer says that Didi quickly made friends, which in normal life is a good trait to possess. But the writer does not stop there and adds that she inspired deep devotion in her friends. This additional information prompts the reader to question the authenticity of the relationship that Didi formed. From my own interpretive lenses, I found myself making excuses for Didi's action because I had a great relationship with my mother. Naturally, I assume that all mothers have good intentions for their children, regardless of the way they present it. At some point, I thought that maybe Didi wanted her daughter to be sick because she had no other options to choose from. Maybe it was a choice of survival for both her and her daughter because she couldn't support both of them if she wasn't receiving help from other people like NGOs. Moreover, in one of the pictures, Didi is wearing a cross. a commonly acclaimed religious object. That sort of drew me to think that she was probably a Christian. From my religious teachings, I know that Christians are good people, and Christianity teachings preach the gospel of peace and love. That lured me to consider that she was actually a genuine person trying to make ends meet in the wrong way, or maybe she had mental disorder. I realized at the end of the article that my biases were influencing what I looked for in the passage. I was expecting more positive things about Didi, and when they weren't mentioned, I felt like the story was not inclusive enough. But wait a minute, maybe there were not as many nice things to say about Didi. While the writer mentions many characteristics of Didi that are consistent with symptoms of Munchausen disorder by proxy, she does not explicitly state that Didi had that form of disorder. However, from a research paper, doctors in the past have had a hard time identifying when a patient is really suffering from this mental disorder, because most of the time they are unable to dissect the motivations of this actor, whether they want to seek sympathy or they want to compensate for stress and low esteem, or whether they are just after monetary benefits. If for an expert it is hard to diagnose, then it would be unfair to expect the writer, who is a journalist according to her LinkedIn profile and has no background in medicine, to be able to accomplish this alone. Additionally, the writer Michelle is an acclaimed critic, commonly known for calling out famous authors like Jeffrey Myers in his book Robert Lowell Love for misrepresenting characters in their work. Maybe she's cautious not to fall in the same trap.